You can take it away when you're ready.
Great. Good morning, everyone. Welcome to the November meeting of the Universal Health Plan Governance Board. We have a smallish group today. We have 4 in the room, 2 absent, and 1 vacancy on our board. So it's a little bit of a smaller meeting today, but happy to see everyone here. Yes, 2 online. 2 online, 4 in the room, 2 online, and 1 vacancy. I'm Helen Belanca, I'm chair of the board, and we can dive right in. Katie, can you do a roll call for attendance?
Yes, just really quickly, Michelle, can you hear us okay? Perfect.
Yes.
Okay, so today's roll call question is either share your favorite Thanksgiving dish or your favorite Thanksgiving holiday. Up to you, or excuse me, Thanksgiving memory. So we will start with Helen Belanca.
I'm Helen Belanca and definitely gravy. Good question, gravy is the best.
Debbie Diaz.
Debbie Diaz present, and I would say one of the things I enjoy about it is it very much open to bringing people outside of your family, just friends or even people that are just kind of without a group. So I've sat at many a Friendsgiving table, probably more than family, and I just love that. And my favorite one, we had a pretty multicultural table, and someone brought a dessert from like a traditional South African dessert called malva pudding. And it is apricot based. It's the best thing I have ever tasted. And yeah, so that's my favorite food and dessert, or no, memory.
Thank you. Amy Fellows.
Present, and probably my brother's homemade mac and cheese that usually brings to all holidays.
Michelle Glass.
Present. And growing up, my kids loved Thanksgiving breakfast. So I would say pumpkin pancakes for breakfast is my favorite Thanksgiving tradition.
Thank you, Michelle. Bruce Goldberg.
Present, my apologies for not being there in person, a little under the weather this morning. My favorite Thanksgiving dish is fresh made cranberry sauce.
Judy Richardson.
Present. My favorite Thanksgiving holiday tradition is running the turkey trot with my family, making them dress up in costumes.
What are you dressing up as this year?
Well, I can't tell, but last
Okay.
year we did Ghost of Christmas, past, present, and future. My husband, me, and my daughter, we won actually.
Amazing. And then we do not have Cheryl Ramirez or Chun Wei Chi, who have previous engagements today.
Great. And I'm very happy to point out that today is Judy's first meeting as our new vice chair. So welcome to Judy. And I think I speak on behalf of the whole board when I say thank you so much for your willingness to take on the role and for serving in this capacity. So yes, welcome. And I'll hand it over to you to say a few words.
Thank you, Chair. It's with humility and gratitude that I have this opportunity to serve all of you and our great state. That's such a big thing. I'll take a moment though to acknowledge appreciation and gratitude to all of you, not just because it's November, but also because I think it's natural for us to be feeling some angst maybe and some anxiety after the latest national election and wonder how that may impact the work that we do here. But it's also a moment to remember that our work is really firmly rooted in the authority and the vision of our state as articulated in the Senate Bill 1058, and that we were created with a really clear purpose to design a universal health plan that reflects Oregon's commitment to equitable and sustainable healthcare for all residents. And that doesn't change. It's still going to be really hard work, but it's still really good work. And it's a moment to steel ourselves towards that goal. Thank you.
Thanks, Judy. As always, we are grateful to the members of the public who have provided testimony for our work. This month, we heard from Dr. Sam Metz, who reminded us of the goals of a single payer system and commented that other problems in the healthcare will likely remain unsolved, but that shouldn't deter us. Tom Sinsick provided 2 pieces of written testimony on the guidelines of executive session and that public meetings law only applies to a quorum of the board of its committees, as well as encouraging us not to focus on the difficulty of the task before us. Richard Gibson commented on the various types of data we will need and the task of reconciling that data. He encouraged us to find ways to communicate between meetings to that end. Dr. Mike Huntington provided testimony that we have an overly restrictive policy on board member communications and urged us to consider changing it. For a quick agenda review after our report from our executive director, we will have a presentation by national experts on the ERISA law, which governs health insurance provided by employers. And there will be some time for discussion and questions after that. After the break, we are going into executive session to get advice from our DOJ lawyer. And then when we come out of executive session, we will have a discussion on whether or not we want to make changes to our policies. We will be finalizing our report to the legislature today. That's our biggest task. We're going to have to take a final look at that and approve that today, as that is due in December to the legislature. And we'll be having a quick discussion on our 2025 meeting schedule. And finally, we'll hear from each of our committees and discuss communication among our committees and how we would like that to go, including how the committees will integrate with the board. It's a busy agenda, a lot of things to cover. What's that?
The agenda. The back of the agenda, there's one.
I'm not sure what you're saying. I'm sorry.
There's more on the next.
That's what we covered. Go ahead, Jenny. What?
No, it's okay.
Okay. Okay, so next, is there a motion to approve the minutes from our October meeting?
So moved.
Second, any discussion? Okay, let's take a roll call.
Helen Belanca,
Yes.
Debbie Diaz,
Yes.
Amy Fellows,
Yes.
Michelle Glass,
Abstain.
Bruce Goldberg,
Yes,
and Judy Richardson.
Yes.
We did have someone sign up for early public comment, but they're unable to attend.
Oh, okay. Okay, great. As a reminder, a quick reminder to the board, sometimes we invite people to do early public comment if they're going to be providing testimony on something that we're taking a vote on during this meeting. But so we'll skip that section as they weren't able to attend. Okay, great. Then I think we're on executive director's report. I'll hand it over to Morgan.
Great, thanks, Helen. First, apologies for missing the meeting last month. I can report that I had a very successful national tennis team competition. We ended up 12th out of 17 teams across the country at our level, but so it was a really wonderful experience to be at the USDA national campus, and I want to express appreciation to the board for letting me go do that and having that experience. So, but I am excited to be back. Before I go into some of the elements of the report, I do want to just share that I'm really excited about the team that we have. At the last meeting, I believe you met Danielle Ross, who's in the room with us today, and Jessica Marino, who are the full-time OHA staff who are supporting the board and committees. I'm happy to share that Laurel Swerdlow and Devlin Prince remain on the team to help support Danielle and Jessica and ensure a smooth transition to the new staff. So we have our cup flow over, like we have so much support, which is wonderful. And really, a lot of the work that we've been focusing on as a team is to get the committees up and running, get good foundational information to the committees, and really set the committees up for success. So you'll hear more about that later in the agenda, so I won't go into that. But there are a couple of issues that are coming up with the committees that I just want to flag for the board that we're seeing. Committee coordination, you'll be talking later between committees, but the coordination between the board and committees will be really important. We have so many experts and knowledgeable public members, and making sure that the work that's happening in those committees is aligning with the work and expectations of the board will be really important, and we'll want to spend time in future meetings making sure that that's happening. Committees are already requesting working groups to do deeper dives. Right now, our board policies really say that the board establishes committees and working groups are only of the board. So might be something to discuss in the future if the board wants to allow committees to establish subcommittees or committees of committees, or if those questions want to come back to the board for the board to continue to kind of maintain its authority to establish those working groups. We'll be talking, you received some public comment about member-to-member communications. You'll be talking about the board policies later, but that continues to remain a question. And whatever the board decides at this meeting, we'll want to make sure that we have good communication with the committee members so that they understand the board policies. Next update, we continue to work on building capacity for the committees and for the committee work. At the last director update, I shared that we have a community engagement contractor, Diana Bianco, who will be starting December 1st to support the community engagement and communications committee. We have that interagency agreement with OHA, and Health Management Associates has been a valued member of the team, providing great health policy support to the Finance and Revenue Committee already, and we're working with them for the next presentation on benefits for plan design. So that has been really great. And we're continuing to work with procurement on the RFP, and it should be released in December. I'm recognizing that Finance and Revenue will need support before we have that larger RFP on. So we're working to figure out how we can expedite that support specifically for the Finance and Revenue and finance work that will be happening. We will need volunteer board members on the evaluation committee, so I'll be working with the board to get some volunteers to support the RFP work. A couple of other updates. We are working with the governor's office on filling the vacant seats. Applications were due November 15th, and so we have a wonderful group of really knowledgeable Oregonians who are interested in that, and we'll be working with the governor's office to find a great candidate. And then upcoming work, after the election, the next step is looking forward to the legislative session. The legislative session will begin in January. Earlier this week, the House Revenue Committee received the December revenue forecast. It's the last revenue forecast before the legislative session begins. Our budget request of $1.9 million is in the DCBS budget as a current service level request, but we'll need to be ready during the legislative session to answer any questions that legislators have and in the Ways and Means budget building process. The next important date is December 2nd, when Governor Kotek will release her budget and give the legislature and the public a view of what her priorities are for this session. So we'll be keeping our eye on that. A couple of other quick updates. I want to share that we have received 12 public records requests. We responded to those timely and in compliance with the law, and have provided the information that has been requested. The public remains very interested and engaged in this work, and we continue to fill all of those requests as they come up. Those are all of my updates for today. Any questions?
How many different people put in the 20? Oh, I was curious how many different people put in the 12 requests?
It's primarily one person, and we've also received a media request as well.
Any other questions for Morgan?
I had a quick question. You mentioned, Morgan, that, quote, "we will be involved in the selection of the vacancy in the board." Who is the "we"?
The chair and vice chair and myself are planning to be involved in that.
Thanks.
Thank you.
I'll add that if any other board members want to be involved and want to hear about the possible candidates and are interested, please reach out to me, and I'd love to hear your thoughts on what you think we need in terms of the vacancy on the board and who you think we should be considering. So please, yes, reach out to me individually, and I'd be happy to hear those comments. Anything else for Morgan? Okay, we are a little ahead of schedule. I want to check in with Katie about our speakers. Should we?
They are online.
Okay,
They were told 9:30,
Right.
but they are here.
So if our speakers are available and ready to start early, we can do an introduction. Now, let's just do a quick check-in with our speakers. Is that okay with you to start a little early?
Absolutely, yes.
Yes.
Okay, great. Great. So we have two guests today to our meeting. Ms. Erin Fusey Brown is a professor of health services policy and practice at Brown University School of Public Health. And she's an expert in ERISA and many other healthcare finance and reform topics. Ms. Elizabeth McCuskey is a professor of health law and policy and management at the Boston University School of Public Health and the School of Law. And she's assistant director of the Center for Law, Ethics, and Human Rights. Her research focuses on state and local reforms that promote health equity, especially related to insurance and access to care. And both of our guests, we were part of, they were consultants to the task force that preceded this group, and their report on ERISA was included in the overall task force report. So we've invited them here today to give us a review of that, and we welcome you both.
It's great to be here. We're happy to be a part of this next phase of the important work that's going on in Oregon. And I think one thing we want to do is just sort of lay the groundwork, and what we were asked to do today is just kind of revisit the analysis that we had done previously 2 years ago for the task force in order to bring this group up to speed. So if there are any sort of continuation of people in the room, then this will seem familiar, hopefully, to you. But if not, then it's an idea. The idea is just to kind of get everyone on the same page as far as the analysis we had done of the sort of ERISA implications of some of the proposals. One caveat is Liz and I have not revisited any sort of updates to the proposal and how it's evolved. So what we're doing is really sort of locked in time in terms of what we understood the policy proposals to be 2 years ago. And so if there are any modifications or updates, we can discuss that in sort of the open Q&A if that raises any different implications or analyses. But we base this analysis on some of the assumptions that we had and the information we were given about the form the proposal took 2 years ago. So let's advance to the next slide. Thank you so much for inviting us here, and again, for that wonderful introduction. We're given 3 questions that we wanted to address the last time we were invited to present. And those really were this overarching sort of analysis, which is in terms of the proposal for universal health coverage, what can states do, and would the proposal's framework align with the requirements or the preemption or the sort of like the boundaries, frankly, and the limits imposed by the Federal Employee Retirement Income Security Act, which is a very complicated federal statute that largely preempts a lot of what states, or ties the hands in terms of what states can do to regulate the employer-based insurance market. Which is, of course, a huge part of any effort to create a universal coverage system. You have to contemplate how is it going to reach and interact with the employer-based market. And so the second question was a little bit more granular and specific about how the state could start to shape the market and perhaps limit or channel private insurance offerings that are either duplicative of or complementary to the state-based universal health plan to be, and do that in a way that would be, again, consistent with ERISA. And then the third question we were asked was specifically whether or not different revenue systems for public and private employers, whether or not it made sense to have it all unified under one or under, you know, a different sort of system for the public employees versus private employees. And so we did a bit of analysis on that. So with that, I'm going to turn it over to my colleague, to Liz, to give you a background on the first question and a background on ERISA.
Great, thank you so much. So let's advance to the next slide. And I will note that, but picking up on comment from earlier, Erin's and my foundational research for this was done during a federal administration that was hostile to the Affordable Care Act and to state reform. So ERISA is a statute from 1974, and most of the stuff a lot just continues on in ERISA, no matter what is happening in the federal space. So this is very kind of counter-cyclical to all the federal chaos that's going on. So for ERISA, we start with the overall preemption framework, which is very different than a lot of other statutes. And the reason that it's so important here is that ERISA preempts states from directly regulating employers' benefit choices and employers' benefit plans. So states cannot forbid employers from offering benefits or require them to offer benefits. And states can't dictate the substantive coverage rules for those benefits if employers do offer those plans. But ERISA does leave room for states to indirectly influence employers' plans of all kinds, to directly regulate insurance companies that sell fully insured plans to employers. It does not allow states to directly regulate employer self-funded plans that take on the risk and use third-party administrators to do the administration. But ERISA still absolutely leaves room for states to directly regulate providers and, of course, to directly regulate the employees, the residents, the patients themselves. So this is needlessly complicated, perhaps not intended to shake out this way, but this is the law that we're working with. So importantly, if we start with the Supreme Court help at the top, there are two recent clarifications from the Supreme Court that are especially useful for states who are trying to kind of capture their all of their spend into a single payer system. The 2020 case called Rutledge, the Supreme Court decided that ERISA did not preempt a state regulation about how PBMs, pharmacy benefit managers, related to pharmacies and did their business. And in particular, the Supreme Court said that ERISA did not preempt this kind of state regulation of PBMs because third-party contractors that an employer plan happens to hire aren't necessarily the plan itself. But I think more importantly for our purposes is that the Supreme Court reaffirmed that indirect economic effects on the insurance market or things that employer plans use are not actually related to the employer plan to trigger preemption. So this reaffirmed an older case, Blue Cross Blue Shield versus Travelers, in which the Supreme Court stated this principle first, that indirect economic effects from state regulation does not necessarily regulate employer plans for preemption. And that was a New York law that required hospitals to collect surcharges for patients covered by commercial insurers, but not patients insured by Blue Cross Blue Shield. So this was kind of, evening out the insurance market and helping Blue Cross for taking on riskier patient populations. That had an indirect economic effect on employer plans, made Blue Cross Blue Shield less expensive, commercial more expensive. And Supreme Court said that was not preempted. That's an indirect economic effect. So even though it may influence what employers would do with their plans, what plan they would choose, it's not preempted. So regulating providers and doing things that are only an indirect economic effect on plans seems fine from the Supreme Court. That's very welcome clarity. So what does that mean for Oregon's overall framework for establishing single payer? We have three main dimensions, right? First, and perhaps most important, getting funding for the plan. So gathering up all the funding streams that are currently paying for healthcare and bringing them into the single payer. But also the non-duplication, so diminishing competition against the state plan from private insurance, and then ensuring sufficient provider participation to make the state plan work. So let's start with the money. So let's start with the payroll tax. ERISA has some especially strong precedent in the Ninth Circuit, where Oregon is, for these kinds of pay or play laws, in which a state or a city imposes a tax on employers, collects that tax, and uses it to fund a public plan. The precedent from the Ninth Circuit makes clear that the Ninth Circuit sees the establishment of a public plan as an alternative to employer plans as just that, as establishing an alternative. It's not directly regulating employers' plans. And as long as the payroll tax is not too exorbitantly high, such that it makes it irrational for any employer to continue offering benefits and pay the tax, then that is not directly enough related to the employer benefit plan to be preempted. So so features of Oregon's payroll tax that are even more useful in this context are keying the tax to wages rather than to any kind of benefits decision that the employer makes. Mandatory as opposed to making it required. If an employer does not offer benefits, they have to pay the tax. That starts to touch on, such to be a little closer to the employer's own decisions. So mandatory keyed to wages helps avoid ERISA preemption. The Supreme Court has not said what a non-exorbitant rate is, but in the memo, we gave some of the data points that the Supreme Court has said are fine. And the, I think, 7-ish% rate seems to be well within that range. Ways to get out-of-state employers. There are, of course, different ways to go around that. But as long as it is still this kind of tax-based as opposed to some kind of penalty for an employee benefit choice, should be fine. We just note that as you get higher on the tax, you run into the state and local tax exemption cap. So SALT issue not in our memo. So that's the funding part. That's the payroll part. I'm going to turn it over to Erin to talk about the other legs of the stool here on the next slide.
Great, thank you so much. And we're happy to take questions. We can geek out on ERISA all day long, but it's more about how it applies that I think is helpful here to the framework of the Oregon proposal or the plan. So the second question is, naturally, when you're trying to create a sort of glide path or a single payer or a universal coverage public state plan, there is this idea of like, well, what do you do with the not only how do you capture the revenues and the funding, but how do you actually move people into that state plan if you can't, because of ERISA, tell employers you can't offer coverage anymore, or you have to offer our plan as your coverage. Neither of those are permitted under ERISA preemption. So what we did is we kind of looked at a bunch of states and surveyed the landscape of how other states have managed to structure this move, right, to shift covered lives, the provider networks, and the people into the state plan. So one common move here is for a state to make it more difficult to offer duplicative coverage. Again, it is not allowed under ERISA, it would be preempted for a state to say to employers, you cannot offer duplicative coverage, that covers the same benefits as the public plan, the state plan. That would be preempted. And so there are things that we've seen other states do, and that is, to basically just say that, of course, kind of quietly acknowledge that employers are going to have the free choice to continue to offer the plans they want. Hopefully the payroll tax will do some of that movement for you, especially moving people, that they could decide whether to buy their, pay premiums for their employer plan or pay the payroll tax and enroll in the state plan. A lot of people will probably just move to the state plan on the basis of the payroll tax incentive alone. But there's this idea that could the state allow or limit the ability to provide complementary or supplementary coverage. So the coverage duplication provisions that back in 2022 were contemplated would allow complementary private coverage for services not covered by the plan. So this maintains this idea of employers maintain the choice and the option to offer benefits that are not covered by the state plan. And either by purchasing it from an insurer or self-funding the coverage, it could basically offer products that, again, do not overlap with the state plan. Again, not prohibiting them from offering duplicative coverage, but saying, certainly complementary coverage would continue to be permitted. And then the proposal would also make clear that employers do not need to continue to offer coverage. So this is this idea that before, the idea that you can't mandate that employers either offer the state plan, nor can you prohibit them from offering their own plan. But you can also make it very attractive to say, if an employer were not to offer a plan, there would be some, that would be allowed. And this might require, again, beyond the scope of this analysis, requires some flexibility from, let's say, the Affordable Care Act's employer, quote unquote, employer mandate or other types of requirements that employers feel are imposed upon them to continue to offer their coverage. So state law prohibiting employers or mandating employers, not okay, but a state law that allows complementary, supplementary, and even substitutive coverage to continue to be offered is necessary to avoid preemption. So the proposal, as we analyzed it, preserved enough meaningful choice for employers along the lines of they could either continue to offer their own duplicative coverage if they wanted to, they could offer complementary coverage, or they could offer no coverage at all and just simply rely on the state plan to cover their employees. All three would be allowed, permitted, and explicitly allowed. And that, I think, is very consistent with this idea that employers are not being forced or mandated or to choose to offer a particular form of benefit to their employees. And that would be consistent with our analysis that would be safe under ERISA. So the second bullet here is provider participation. Another way to move people into the state plan is to have them follow their doctor. So people follow their providers, their hospital, their doctor, their favored providers. In a large, we know that this is sort of behavior that patients have, is that they feel pretty loyal to their doctor-patient relationships. And so one of the keys to kind of moving covered lives in and out of the state plan is to kind of bring the providers into that plan and have a broad enough network, if not a very, very broad network, so that patients feel like in order to continue their provider-patient relationship, the best way to do that, or one way to do that, would be to join the state plan. So the one thing to be clear from the ERISA standpoint, states have the most latitude under the Travelers and the Rutledge decision to regulate providers. That is considered inherent in the power of states to regulate the provision of medical care. Both hospital and physician regulation, for example, is clearly in the purview of states and not considered to be running up against ERISA preemption problems for the most part. So the proposal contemplated that the plan would pay providers directly at, of course, sort of administratively established rates. And then there was this question about sort of what is the enrollment or eligibility process for the state's providers. So there could be this idea of basically telling providers that you have to enroll or you can no longer contract to be a participating provider with any other private plan, employer-based or otherwise. And that might be a problem because of even though the state has the ability to regulate providers, what it would do is it would essentially it would starve the providers of the employers of any providers at all to build their networks. And so it was essentially through a backdoor channel, essentially kind of eliminate the existence of those options of the employer-based option, because the providers would be both automatically enrolled if they're in good standing in the state plan and told they can no longer contract with private insurance plans. So something softer than that would probably be necessary. And so one of the things is to say all providers would be automatically eligible to enroll in the state plan, meaning if you're in good standing and licensed in the state, you're eligible to be a participating provider in the state plan. But if you choose to enroll in the state plan, then you need to make a choice of whether you're going to exclusively participate in the state plan or exclusively participate in other coverage options like employer-based plans, private insurance networks. And if that would be more permissible, sorry. That would be more permissible because it would sort of, again, allow it to be the choice of the providers, the physicians and the hospitals in particular. Of course, it runs the risk that I think with hospitals, there'd probably be enough volume in the state plan that the hospitals would feel the need to participate in the state plan, but individual physicians might choose otherwise. So there's a risk there. So another way to do this would be to allow providers, third option was to allow providers to continue to participate in both the state plan and contract to participate in other private insurance networks, but use the third and the fourth bullets here, reimbursement and recoupment. So this would basically turn the state plan into the first payer, in the sense that it would be collecting, the providers would turn around and bill the state plan for all the services provided at the administratively set rates. And then if someone had duplicative coverage, let's say a resident had employer-based coverage, then the state plan could turn around and seek reimbursement from that employer-based coverage as the primary payer for who's responsible for covering that service. And so those are sort of one way to kind of think about how you would structure the provider participation aspects of it. Knowing that the sort of first one, which is more or less off the table, you can't sort of both automatically enroll all the providers and tell them they can't participate in employer-based networks. But the second and third are sort of two flavors of the same coin, in terms of one would just say, okay, providers, you're automatically eligible, but if you choose to participate in the state plan, you can't participate in private networks. Or the final one is really to say, actually, we're not going to tell you can't participate in provider networks. You can't bill more. Frankly, you can't earn more by providing in other networks. And then the state plan is going to have to assume an administrative billing and collection function, where it basically serves as the billing agent, where, you know, the providers, like, you get administrative simplification. There's one rate, you bill us, we'll pay you. And if it turns out the person has duplicative coverage, then we'll turn around for the state and collect, the state plan gets to collect that reimbursement from the employer-based plan and keep any difference. So I think those are sort of two complementary ways to think about provider participation, again, with this idea of moving people and dollars, but also, most importantly, thinking about how do you build that provider network for the state plan. Sorry about my coughing fit in the middle of that. I'm going to turn it over now to Liz to wrap it up with the third question.
And I'll just warn you guys that here on the East Coast, everybody has a coughing fit right now. So this is par for the course. So on the next slide, I think I want to take just one step back, because we have been lauding the detail and thoughtfulness of Oregon's work on this plan to show that these kind of thoughtful, detailed ways of avoiding direct regulation of employers are the things that will help survive an ERISA preemption challenge. So let me take a step back and just say kind of what that challenge usually looks like. It's litigation brought by a large employer or a large employer trade association. And the litigation says we shouldn't have to comply with what the state wants us to do. It's preempted by ERISA, right? So we shouldn't have to do this. There is almost no downside for those groups to litigate, and they have they have entire associations that are devoted just to bringing these cases. So it's really thinking through like the strength of the case, right? So so it's a strong case, but doesn't mean that there won't be a challenge. So then thinking through things that that might make the state law look more like it is targeting ERISA plans, so private employer plans. There was a question last time, if we have different revenue systems for public employers, right, state and federal employers versus private employers, how does that impact the analysis? So there's nothing inherently wrong with having different collection mechanisms or different treatment of those employers. And certainly, the employees on the income tax side would be treated the same. But coming back to the problem with ERISA preemption is that the language of the statute is very broad. And the language that the Supreme Court has used to interpret the statute is very hard to understand and also broad. So state laws can provoke a challenge for preemption if they make reference to ERISA plans. So if you say something directly about private employer benefit plans, or, and then the second term here, if they are only about private employer benefit plans. So if they act immediately and exclusively on private employer plans, or if the only way that the law can operate is that private employer plans are operational, that could also be too much. So the last category is not necessarily relevant to Oregon's project, because the idea, right, is that that ERISA plans would be obsolete, one would hope. But at any tailoring of the law that singles out private employer benefit plans or depends entirely on private employer benefit plans would have a little more of a challenge behind it. We did not see specifics in the proposal that we looked at that would do that, but it's worth noting that this kind of hangs over a lot of policy choices, the kind of the threat of litigation and the unclarity of the statute. So in total, we remain incredibly delighted about the thoughtful, detailed work in the plan. And although ERISA makes it so that you have to kind of wriggle around federal law and maybe not do things in the way that would be preferential for policy, this kind of payroll tax plus non-duplication plus provider regulation does hit the target to avoid ERISA preemption. So we would love to talk about ERISA for as long as you can stand it. So welcome any questions that you would have.
Question, just for clarification, this is Helen Belanca. So we talk a lot about avoiding ERISA challenges, and it helps me if I really fully understand what ERISA was intended to do. Like, what are the protections that it offers to employers, and why? And my understanding is because we have set up, I just want to correct me if I'm off on this, we have set up a system in this country where employers are responsible for paying for the health insurance of their employees as part of the benefits that they offer. And that's a very prominent aspect of our economic culture. And so if the state were to regulate employers on how they provide health insurance, it would impose, I'm guessing, a financial burden. We would be telling them, you have to do this, you have to do that, and that would cost those businesses money and then that's considered an unfair regulation of businesses. Am I on the right track on that? Or what is the purpose of ERISA? What is it meant to protect?
You are absolutely on the right track. The bargain that was struck in 1974 was something that tracks basically what you just described. So in exchange for accepting federal regulation of benefits, primarily it was designed for pensions to make sure that employers weren't squandering pension funds. So in exchange for accepting a new federal set of regulations about securing the benefits promises, large employers and labor unions requested that only the federal law be what they have to comply with. So the idea was it would be too lugubrious and expensive for us to continue offering benefits if we have to comply with both federal and 50 state laws. So we need the preemption.
And I
The
will
problem-
add, yeah,
Go ahead.
add a wrinkle to that, and that is that in 1974, the vast majority of health insurance benefits offered even by employers were state regulated, fully insured plans. And that, so we're talking as though the entire employer-based market is made up of, self-funded ERISA plans that are protected by this sort of preemption effect. But really, there is still this sort of significant but smaller portion of plans that are fully insured, part of the state insurance regulation. And those 50 state insurance regulations were contemplated to continue to persist after the passage of ERISA. So none of what we said today applies to fully insured large group plans, including those offered by employers, if they're state regulated insurance plans. The problem is that about 10 years after the passage of ERISA, the Supreme Court basically plucked a very unclear provision of the statute and interpreted it in a way to create this extremely large loophole for self-insured or self-funded health plans by employers that keep the insurance risk on themselves, self-fund their plan, but essentially outsource all the administration of those plans to third-party administrators, and said those states can basically not reach those types of self-funded plans with state insurance regulation. That opening created the sort of stampede of, the large majority of the market to move in the direction of self-funding to escape state insurance regulation. But if you were wondering along the way, well, what about all of the state health insurance regulation that we understand to be in effect, that still does apply to the fully insured market. And there's a lot more the state can do in the fully insured market. We're just talking about the self-funded market.
Go ahead. Bruce, go ahead.
Yeah, Professor, it's great to see you again, and
to
thank
see you,
you
Bruce.
for all of the great work you did. I think you've put together a really elegant framework for how we can sort of deal with an ERISA lawsuit. Having said that, our previous task force didn't officially land on a revenue scheme, although we talked a lot about a combination of a payroll and an income tax. At the end, we ran out of time and never officially endorsed a revenue scheme. And so my question is, we now have a finance group looking at how to fund our plan, and they'll make some recommendations about revenue. Are we locked? Does this framework that you put together lock us into a payroll tax? Or put another way, what would happen if we didn't have a payroll tax as part of our revenue scheme? Your thoughts on that?
So I'll just start with the logistics of what we understand, like the payroll tax to be capturing. So you're trying to capture both what employers are spending on premiums right now and what employees are contributing to premiums. So individual tax, right, captures the employee part. So the question is, how do you take the employer's money that's currently being paid to premiums, right? So thinking about that collection mechanism is where we understood to be a payroll tax, and that's a frequent mechanism that state proposals choose. Erin, do you know of alternatives?
Yeah, I think, and I studied this in terms of looking, I did another study similar to this one methodologically, looking at state public option proposals. And what was more common in those, and I don't know if this is off the table or on the table for the universal health plan proposal here, is instead of a payroll tax, or in addition to a payroll tax, is to look not to an income tax, which has the downside of what Liz just mentioned, which sort of hits the employee side, not so much the employer side of spending, but a sort of looking at reframing the payroll tax as a premium. And again, the messaging, right? Like sometimes it's easier to sell a universal program, health program by saying, as Bernie Sanders did, you're not going to pay premiums, you're not going to pay cost sharing. It's just like, it's part of what the state provides to you. But it is permissible to frame it as premium payments, as long as it's not calculated or pegged to the employer's current offering of its own benefits. Meaning the premium would be at that point only sort of like something that you would pay only if your employee selected on their own accord to enroll in the state plan, as opposed to the employer offered plan. Again, you can't tell the employer it can no longer offer a plan, but if the employer were to use its spending to pay the premium, both the employer share and the employee share of the employee that opts themselves into the state plan, then that is another mechanism to capture that spending. Again, that looks more like a public option than it does a single payer plan, because it sort of relies on that choice, right? That sort of that choice between competing options on the part of the employee. But that would
Great.
also survive ERISA preemption, as long as it preserved the options and the choices between for the employer to continue to provide its own coverage.
Thanks.
Wedding.
Yeah, my question may be kind of more for us, but the conversation made me wonder if staff or one of the work groups is tracking, and if we know how many of the health systems in Oregon are self-funded. Like, I know that Peace Health is, and I'm not sure if Kaiser and Providence, who both have insurance and our health systems, are considered that. And then, Oregon Medical Group was bought out by Optum, which is owned by United Healthcare. I don't know if they only offer their employees United Healthcare. So I'm just wondering, it seems like that might be something really important for us to track and know. Those big systems are gonna be influential in our work.
In general, larger employers almost always self-fund. That the ones who tend not to are the smaller employers, just as a general observation.
I had another question too. How would this framework play out for an employer that is based in Oregon and has Oregon employees, but also employs people who live in other states? And so their employees who live in other states would not be eligible for the Oregon Universal Health Plan, but they're still depending on their employer for healthcare. So could an employer like split how they cover? Could they pay a payroll tax for some of their employees and then still provide direct insurance to their out-of-state employees? How does that work?
Yes, I believe that's sort of how it would work for, an employer, whether they're based in Oregon or not, as long as they had an Oregon presence. For the Oregon residents who are employees, they would, have the sort of state plan as one of the options, or at least as and be subject to the payroll tax. And then it's just a question of what do they do for their out-of-state employees or their non-Oregon employees who are not going to be getting services and not eligible to get services and wouldn't ever use services in Oregon. Then yes, they would probably almost certainly continue to offer their own alternative employer-sponsored plan for those employees. And then the question is like, and then they would have the choice to continue to offer that as well for their internal Oregon employees, right? I mean, the state plan can't supplant it entirely. It's just a matter of whether those employees would say, I don't choose to double pay. I'm just going to pick the state plan because that's where my doctor went.
And the reverse would be true too, right? So if there's if an Oregon resident works for an out-of-state employer, could Oregon impose a payroll tax on that out-of-state employer to cover the Oregon resident? Like, so yeah, in the reverse situation, does it still hold?
I believe so. I'm not 100% sure, but yes, it would track however the sort of state's taxing authority applies to residents who pay taxes in Oregon, but who are employed by non-Oregon employers. I would imagine it would be the same mechanism. Again, and that's the benefit of pegging it to a payroll tax and not to an employee benefit, right? Not only do you avoid the sort of ERISA entanglement by not calculating the tax or making the tax contingent upon the employer's benefit offerings, but you also don't, then you can basically just sort of tax the payroll, the wages of the Oregon resident in order to fund their healthcare through the state plan, which they're eligible for. But then the employer is basically just subject to a separate payroll tax for that Oregon resident.
And then my final question would be, so just again, to make sure, like, it really helps me to understand, like, from the employer's perspective, like, why this is a problem, like, the basic question is like, why would they challenge this? So like, of all of the headaches of administering healthcare for their employees and the cost to them, especially as premiums rise and just in this out of control market with rising costs, it seems to me that providing healthcare to employees is a problem for many businesses and an economic burden for them. And so why would they challenge this? Why is it in their interest to, like, watch for any opportunity to challenge this plan? Like, why wouldn't a state offered plan be of benefit to these large employers instead of something they see as a threat? I'm not sure I understand that.
So I mean, you're absolutely right, logically, right? Particularly for large employers that are more based in Oregon or are a large employer, single state, or just kind of in the tri-state area. There's a national policy organization for large multi-state employers who has just taken a hard line on ERISA preemption being a valuable source of deregulation for employer-sponsored insurance. And they are actually on record in House testimony talking about that's the most important thing for them, and that they will challenge even state regulations that would bring costs down in order to preserve the opportunity to use ERISA preemption against regulations that they don't like in the future. So I'm saying that is that's an irrational, from a health policy standpoint, position, but it is one that is explicitly taken by the ERISA Industry Committee.
But also from a political perspective, there's likely to be challenges just from those who are opposed to a state single payer plan and who will just challenge this. So, I mean, I think regardless of rational thought or intention, this would be challenged. Our goal, as you've laid out, is to put together something that would survive a challenge.
And we often refer to this as increasing the transaction costs for universal healthcare. It's not that it prevents you from doing it, because we think you've done it in a really thoughtful way that should succeed. But the threat of litigation that ERISA preemption holds just creates a headwind, even where the policy motivation should be more universally accepted. Does that help? Sorry, I don't have a satisfactory explanation for it.
Yeah, it's right. Yeah, it's really okay. Yes, thank you. Go ahead, Debbie.
I'm curious, in the event of a challenge, what are the options then? Can it be presented again with modifications or tweaks, or is it once it's challenged and that challenge is upheld, that it's squashed dead in the water?
Yeah, so one of the ways to strategically write legislation that is more resilient against ERISA challenge and the uncertainty that there may be elements of the proposal that are more problematic or more risky than others, then I think you definitely want to include an explicit severability clause in the legislation that basically says, in the event that any of the provisions is struck down for whatever reason, the rest remain, right? That it doesn't take down the entire legislation. But you have to think about the interaction, right? Like, let's say the payroll tax is the thing that gets struck down, then can the rest stand, right? I mean, I think practically speaking, you might be back at the drawing board, but I think when you're talking about and I'll turn to Liz, who's like more of the civil procedure expert, on whether you would be foreclosed from bringing that, a similar version of legislation with a tweak to address that problem back. My guess is no, that you would not be or not stopped from doing that. But Liz, I'll let you confirm.
Yes, you could revise and resubmit. If it's exactly the same, then you wouldn't have a case. But if you change it in any way that responds to whatever the decision is, that's a new, you start over. Sorry, in the litigation, you get to defend yourself again.
You get to, right? Yeah.
It turns out I could probably talk about this all day too, but I have one more question. You said something and I want to make sure I got it right. That part of how part of the framework of avoiding an ERISA challenge is if we imposed a payroll tax, it would have to be mandatory for all employers and not only for employers that don't provide health insurance for their employees. Did I capture that right? And
Yes, that's the safest way.
Yeah, and that's because if it was only applied to employers that didn't offer insurance, it looks like it's a. Can you explain that a little bit more? Like why is that an important facet?
So first, it looks like the payroll tax depends on the existence or non-existence of an ERISA plan.
Okay.
So that part of ERISA that the Supreme Court said if it acts immediately or exclusively on ERISA plans, that's a little bit of a connection. But if it has a connection to the existence of an ERISA plan, it can also trigger ERISA preemption. So making it dependent on the existence or non-existence of an ERISA plan, but raises that problem. It's not totally fatal, but it makes it much harder to defend.
Yes, absolutely. And then functionally, what you want to do is, and what you can do is create economic pressure for the employer, but more importantly, the employee, right? The employer may say like, well, we're going to continue to offer our plan, our own Walmart plan or whatever it is. And what you want is the employee to say, wait a second, I'm already paying this payroll tax for this state plan, which is comprehensive in coverage, better cost sharing, and my doctor and all the hospitals that I'd ever want to go see are in that plan. Why would I buy my employer plan? I'm going to move. I'm not going to pay the premiums. I'm not going to enroll in my employer plan. I'm just going to, why pay twice for something I'm already paying for? I'm going to move into, so that you're moving you're sort of getting the employees to vote with their feet. And enough of them move over, then you don't need a mandate for the employer. And then eventually, I mean, whether or not the employer drops their plan or not, there'll just be some vestigial, people who remain in both. They're sort of, it's like people who continue, and I'm one of them, paying private school tuition, even though my property taxes pay for my kid to go to public school, right? There are going to be some people who stick that out. And so I think one of the ideas is to create a glide path to move most of the market without necessarily structuring it. So it creates that legal challenge of the connection to the ERISA plan of the employee or the employer's plan. But also you want to create that sort of mandatory, that pressure, that sort of, who wants to double pay? Like that's going to move most of the market.
They are also though paying an income tax in theory, right? So we did have an income tax. So those employees would have like an income tax that would go to the plan and they'd have a payroll tax. Is that right? Like for an employee of a big company, they work for a giant company and they would be taxed as an individual at income level to help pay for the plan. And that's the part that's covering like what they would have been paying out of pocket. That's that chunk of money that was going to their healthcare. And then they would pay a payroll tax on their wages also going to the plan. But they would then choose not to pay for their employer sponsored insurance. Is that right?
Right. It doesn't necessarily change their income tax obligations, both federally at the state level, which pays for other stuff, right? I mean, right now the income tax is not paying for their healthcare. They're paying separately through premium contributions. And so then it's an additional payroll tax keyed to their wages that would be used to pay for the state plan. And then they would have a further choice of whether to continue to pay for the premiums for their employer plan as well. And the answer is most rational employees would not, so provided that the state plan. So it doesn't change, it doesn't sort of change the income tax, but the income tax is not currently, as far as I know, part of the funding mechanism for the state plan.
It is. Yeah, I mean, I think our revenue plan, I mean, as far, like Bruce was saying, we haven't really, sorted out the details yet, but like a general feeling about how the revenue plan would work is that there would be an income tax, a progressive income tax, and then a payroll tax, and those would be our main revenue sources. And so there would be a new income tax.
I guess what I'm saying is it doesn't change the sort of today income tax level, right?
That's right.
And so then if you were to structure whatever additional tax, it could be split between income and payroll. Yes, so it does.
Yeah, got it. Yeah, okay. Yeah, Michelle, you have your hand up?
Yes, thank you, Chair. And thank you for this presentation. I'm wondering if I misheard you or misunderstood you. I was wondering if you could clarify. I think I just heard you say that the payroll tax would have to apply to all employers. And I'm curious if what you're saying is that, I mean, I hear loud and clear that we couldn't make it contingent on whether the employer offered employer-sponsored healthcare. Do we have any options at all to make it apply to employers over a certain number of employees in response to concerns from small operations and that sort of thing that's not connected to whether or not employers offer healthcare, or does it have to be applied to all employers regardless? I guess that's my question.
So in my view, you could have different rules for large or small employers. Erin, do you share that?
Yeah, I agree. I think the thing you're trying to avoid is having the existence of the payroll tax or what, be tied to the offer or not offer of employer-based coverage, not tied to the size. So it's the latter, the former that is the problem, not the latter.
And even though the federal Affordable Care Act employer mandate, right, has a benefits choice at 50 employees, right? Employer mandate or else tax at 50 or more, but not or 50 or below. But that doesn't have anything to do with your state choice.
Thank you.
So we could either stick with that 50 employee limit or do something different? Is that what you're saying? Like we could say, if you have 50 or fewer employees, you're exempt from the payroll tax. Or we could say if you have 100 or fewer employees, you're exempt. Like we don't have to follow. We could decide at what point, because it's a state payroll tax. So we could decide at what level it applies, right?
Yeah, exactly.
Okay. Great. Anyone else have questions for our guests or want to kind of delve further into this in terms of the next step for this board? Any additional policy questions, any implications for our committee work? We've
Well,
already
just a
talked a bit
comment about that, Ellen,
Yeah.
that, this makes it clear that our revenue group needs to really stay close to Liz and Erin for input so that we don't go off in a direction that puts us at maybe fine from a revenue standpoint, but puts us at risk for ERISA.
Right. Yeah, we'll have to underscore that with that committee for sure.
Assuming, of course, that Erin and Liz are willing to help us out in the future.
Yes, we are. We're happy. We're happy to help. If it's going, if it's helpful, I think Liz circulated the memo that we prepared that does explain all of this in much more detail. And so again, it tries to kind of map out some of these different options and the sort of pros and cons of each of the approaches. But yes, we're certainly happy to do technical assistance moving forward.
Yeah, this combined with the information we got from the Legislative Review Office, Legislative Revenue Office, on options for taxes and how taxes affect different segments of our population is going to be really important to consider in terms of how we want to advise the Finance Committee in terms of structuring a revenue strategy to fund the plan, how much of it comes from an income tax and at what level, how much of it comes from a payroll tax and at what level to employers. Because one of the principles we had talked about is we don't want a universal health plan that inadvertently creates financial hardship either for households or for small businesses, which are the majority of our businesses in this state. And so how do we understand sort of the landscape of the business community in Oregon and the levels of financial burden that this would cause? If anyone else has thoughts on that, like how we think about revenue, income tax versus a payroll tax in terms of Oregon's environment. Yeah.
And also, of course, how much of burden it would eliminate, as you alluded to
Yes.
earlier.
Yes.
Right,
Thank you.
like
Yes.
eh,
Small
Yeah.
businesses have a notoriously difficult time finding affordable good coverage. So,
Yeah.
you know, to highlight the sort of, it's not just an additional, but but it would relieve them of certain expenses as well.
Be interested to as far as the exemption and thinking through as far as like a state exemption that would be different than federal. I guess it would be helpful to know in the state how many businesses are what size when we think about that cutoff, because we want it to not be punitive, but also if we're removing the majority of our businesses, then it's maybe not viable. So that would be, and I personally have no idea how, you know, the average business size. Yeah.
My understanding about ERISA too, that there's another provision there that is difficult to get data, isn't it? Like, there is something in the ERISA provision that says the state can't require them to report. Am I remembering that right?
Yeah, there was another decision, the Gobey versus Liberty Mutual decision that basically says self-funded ERISA plans and their third-party administrators can't be required by the state to contribute data to the all-payer claims database. So their claims data are not usually represented in the APCD. But that would extend to a larger sort of principle that states can't require reporting of additional data related to their plans from self-funded plans.
Because I was asking early on, like, well, how much are they currently spending? And like, we can't know that, right? We can't know how much employers currently spend on healthcare for their employee. If they're a large employer in a self-funded plan, we can't find that out, right? Because of the protections of ERISA.
you can absolutely ask them.
But they don't have to tell us. Is that the idea?
Yes. They, yeah,
there may
go
be
ahead.
some researchers that can help estimate spending by state, just based on sort of like larger market trends. But it won't be precise to the, you know, I mean, it'll be sort of like based on the sort of spending levels, penetration of employer-sponsored healthcare, et cetera, and sort of premium equivalents. So there are researchers, including, like, I have a colleague, Roz Murray, who does some of this work. Georgetown has some researchers as well who have sort of good employer-based data, and I don't know, Liz may have some colleagues as well. So it's not that their estimates couldn't be obtained, but yes, you couldn't just mandate that they tell you or look at your APCD and see how much is being spent.
Any final questions? I want to say thank you very much to Professor Fusey Brown and Professor McCuskey for joining us. We really appreciate your expertise and your ongoing support of Oregon's work in this area, and we look forward to maintaining that connection. But thank you so much for joining us today.
You're very welcome, and congratulations on the great work that you have already done, and we will follow with interest.
Yes, thank you so much for having us.
Okay, great. Now is a good time for a break. It's 10:15. We will reconvene at 10:25. Is that right? 10:25. See you then. Great, it's 10:25 and we are reconvening. Great, the Universal Health Plan Governance Board will now meet in executive session at, is it 10:26? What does it say on our official time?
Yes, 10:26.
At 10:26 a.m. The executive session is held pursuant to Oregon Revised Statute 192.660(2)F for this session, which allows the board to meet in executive session to consider information or records that are exempt from disclosure by law, including written advice from board counsel. Representatives from the news media and staff are allowed to attend. All other members of the audience and public attending virtually are asked to disconnect from the Zoom and leave conference room 260. News media are specifically directed not to record or report on the discussion in executive session, except to say the topic as previously announced. No decisions or votes will be made in executive session.
Okay, at this point, I'll be putting everyone into the waiting room, so it'll just be a moment before we can begin. All members have been placed, all viewing public have been placed in outside of this, and I'm just gonna pause recording and I'll pull up your slides. Public has been let back in and the recording has resumed.
Okay, can you tell me the time?
And it is 11:02.
Okay, great. So the time is now 11:02 and the board has concluded the executive session and will now re-enter the public meeting. No decisions were made or votes were taken outside the public meeting. Katie, would you roll call?
Yes. Melvin Belanca,
Present?
Debbie Diaz,
Present.
Amy Fellows,
Here.
Michelle Glass,
Here.
Bruce Goldberg,
Here,
and Judy Richardson.
Present.
Okay, great. So next on our agenda is a discussion about our policies and procedures as they pertain to communication among board members and committee members outside of our scheduled meetings. And we have some options for discussion. This group can decide to make no changes, or we are available to entertain and update our policies to allow for more interaction between board members and or committee members. Or we could just scratch our current policy and encourage the board and committee members to follow the law. So go ahead, Katie. So option one, this is our current board policy regarding communication between meetings. I think everyone's familiar with it, but basically it says that in order to prevent an inadvertent non-public convening of a quorum of the board, members should avoid communicating with other members of the board on any matter relating to the board. So again, it says should avoid. It doesn't say you cannot communicate. It just says you should avoid it because that is the most conservative approach with the goal toward transparency in all of our work. And the recognition that an inadvertent convening of a quorum is pretty easy to get there. It's pretty easy to inadvertently get to a quorum without realizing it. So our policies currently are conservative. They don't prohibit communication, but they encourage us to avoid communicating between public meetings. Next option is to consider updating our policy slightly to allow for more interaction between board members. Instead of saying that we should avoid communication, it says members should limit communication with other members of the board on any matter that could be considered deliberations on board business or the member's work and participation as a member of the board. And then accordingly, that, you know, we create some structures, as Judy has suggested in the past, about like just reminders on our emails and, you know, kind of reminders that when we're meeting with each other, and that emails and requests to each other that involve educational or factual information would be allowed, but being careful not to have conversations that might lead to a decision. And then option 3 would be to delete our current policy altogether and replace it with one that says board members should familiarize themselves with current Oregon Public Meetings Law and changes created by House Bill 2805. And make efforts to avoid the inadvertent non-public convening of a quorum, and include some best practices there. So just basically understand what the law is and follow it would be option 3. And then Bruce, did you want to offer another option?
Yeah, thanks, Helen. Yeah, my option would be to delete the language and instead, just as background, I think there's a lot of confusion amongst both board members and committee members that it would be, I think, important for us to clarify. So I would suggest that we delete that whole paragraph and replace it with the following. Communications amongst less than a quorum of the board is permitted, so long as it does not create a serial communication creating a quorum. A quorum of the members of the board shall not, outside of a meeting conducted in compliance with the Public Meetings Law, use a series of communications of any kind, directly or through intermediaries, for the purpose of deliberating or deciding on any matter that is within the jurisdiction of the board. I just think that clarifies things, and it's actually consistent with some language from the head of the Ethics Committee.
Could you please email that to Katie?
Yeah, I'd be happy to,
Um,
if I'm allowed.
Go ahead, Amy.
I'm just wondering, is the language on the slides just addresses the board, and with whatever we end up deciding on it, will it include committees as well?
Yes, so one of our policies is that all board policies automatically apply to the committees. And so, yes, anything that is decided here also applies to all of our committees.
And just to add, I think after the board makes the decision on this, staff will work on a communication document to committees to help share the final result of whatever the board decides with committees, so that we can decrease the confusion that's happening.
Go ahead, Michelle.
I have a request that communication, and you probably were already planning on it, but just to be sure that communication also includes notifying all committee members of the consequences of a violation of the policies. Thank you.
Would anyone on the board like to propose a motion?
Like, are we saying 1, 2, 3, or 4? Or like 4 being Bruce's?
Well, the question is, do you want to amend, do you want to amend our current policies and procedures? Perhaps we should start there. So our current policy says that board members should avoid communicating with other members. And perhaps we should start by taking a vote on whether or not we want to keep our current policies or amend them. So someone could make a motion regarding either of those.
I move that we amend the current policies and procedures.
And
Second.
seconded by Judy. Okay, yeah, Michelle. Okay. Okay, let's do a roll call vote. Any discussion first?
Oh,
Michelle, go ahead.
I just want to state for the record that I think a lot of us on this board have served on other public bodies before, and public meeting law is really important. And I am personally committed to public transparency and preserving the public trust. And I think that the current policies in response to and some interpretations of a change in public meeting law are interfering with the ability of the board to conduct business as state boards and commissions have done for decades. Most current public policy was created through boards that were able to do some level of information sharing outside of the very limited number of meetings that we have before our legislative authorization sunsets. And we were tasked with a large body of work. So I just want to state for the public record that this is really to be able to move this work forward on behalf of Oregonians while preserving the public trust and public transparency. So want to make that intent really clear.
Thank you, Michelle. Any other discussion? Okay, so we're doing a roll call vote, and a yes vote means you would like to amend our current policies.
Helen Belanca,
Yes.
Debbie Diaz,
Yes.
Amy Fellows,
Yes.
Michelle Glass,
Yes.
Bruce Goldberg,
Yes,
and Judy Richardson.
Yes.
Okay, so now we are open to entertaining a motion for how we would amend them. If anyone has a motion and suggests how that would happen. And if Katie, is there any way to pull up Bruce's on the screen so that we can see that one as well?
It'll take me a second because I logged out of my email, but I'll get right.
Yes, no problem. So the second one was maybe, can we see the? No, you
No.
can't do both. We can't do both. But in our, okay, so the second one modified the language slightly. Yes. So, thank you. Option 2, that was already offered, says, so as to prevent any inadvertent non-public convening of a quorum and avoid appearance of board business being discussed or conducted other than in a properly noticed public meeting, members should limit communication with other members of the board on any matter that could be considered deliberations on board business, or the member's work and participation as a member of the board. That's the first option. It just says we should limit it. And then it has a second part that says accordingly, when sending email to, replying email from, avoid replying all, unless asking for educational or factual information. So that's one option. A second option that was already proposed was delete what we have and just say board members should familiarize themselves with current public meeting law, and make efforts to avoid the inadvertent non-public convening of a quorum. And then best practices about not replying all and asking only for factual information. So basically option 1, limit communication. Option 2, learn the law and do your best to avoid inadvertent convening. And then is this Bruce's up here?
Yep.
Okay. And then Bruce's says that it's more proactive, saying communications among less than a quorum of board members is permitted so long as it does not create a serial communication. Creating a quorum of the board shall not, outside of a meeting conducted in compliance with public meetings law, use a series of communications of any kind, directly or through intermediaries, for the purpose of deliberating or deciding on any matter that's within the jurisdiction. So would anyone like to propose a motion? Amy, did you want to?
actually, before we have a motion,
Okay. Yeah,
before we have a motion, could I see, because it may be hard to, there's 3 different options. Maybe it would help to have a discussion and see where we might be on those before we have a motion.
sure. Absolutely. Go ahead.
On Bruce's, I'm wondering if we need to define what a quorum is.
That's already defined in our policies, I believe.
Define those for our policy.
Yeah, it's half plus 1.
Okay,
Those present. Half plus 1 of those present, yeah.
and how does a quorum relate to committee members talking amongst themselves?
Can you be more specific? I don't know.
So if committee members.
Yeah.
Like, you know, the communication and engagement.
Yeah.
Committee. If committee members have conversations with each other,
How many members on the committee?
14 hours.
Right, so if 8 or more are gathered, that's a quorum.
And Jake, Okay. Jake just clarified that the quorum requirement is a little bit different for the committees, but it is that majority of those appointed
Majority appointed.
Majority of the number of spots.
of the number of spots. So if you have 14 spots, then it would be a majority, so it'd be 8.
But even if the spots are vacant,
Yes, it's different for the board than for where there's a statutorily defined quorum. Committees, it goes to the default rule, which is a majority, not of the members currently appointed, but a majority of the total number of spots on the committee.
so it's a majority of the positions on the committee is the quorum. Any other discussion on these?
I would just say that I am leaning more towards, Bruce's wording of the communication, especially if it's mirroring some language that's already given by the ethics, committee or commission, there we go. And at least to me, it feels like it'll be better understood. Easier to, it just seems more straightforward in plain language to me. So I think that'll be really helpful for both the public and for our committees to understand.
I'm leaning towards that one as well, but I'm biased.
I agree with that.
Yeah, so being really clear about, I would like to add a little bit of language in this definition about recommendations based on what we just heard. So use a series of communication of any kind directly or through intermediaries for the purpose of deliberating, making recommendations or deciding on any matter. Yeah, so I just, the making recommendations phrase in there as well, I think is important to include.
I'm gonna jump back to the PowerPoint and add it. And then you can tell me that again.
Okay. I also really liked Michelle's language about a commitment to transparency in all of our decisions. And Michelle, if you want to propose like a little bit of phrasing, so like maybe at the very beginning, so the board and all of its committees maintains a commitment to transparency in the work that we do for the public. So you can go ahead and propose. I'm not sure if I can come up with an adequate summary of what you said, but so we are committed to transparency, but we also have very creative and sort of complex work to do that requires a lot of iterative conversations. So something that reflects both our commitment to transparency and the realization that we have to do that kind of complex work.
Having some issues on my. Here. Michelle's.
We're gonna get Katie on, and then you can propose.
Did you want to make updates to, tell me those updates again for Bruce's?
So just adding the phrase, so at the very last sentence, it said,
Oh, here, let me share my screen, sorry.
for the purpose of deliberating, making recommendations. And then the rest stays the same,
Deliberating,
Just making recommendations.
okay.
making recommendations.
How do you spell it? Okay,
And then Michelle, go ahead, what would you suggest?
So I would propose something along the lines of the board and its committees hold a firm commitment to transparency and upholding the public trust as a statement at the beginning of this section. And then maybe as a transition sentence saying something like to facilitate the something about, really making it clear that the purpose of this limited communication is to facilitate the work of the board in service to our mandate from the legislature and to Oregonians, or something along those lines, just to make it really clear that this is a focused, limited form of communication for a specific purpose.
Like, we also recognize that it's important to have additional conversations to facilitate the work of the board. Something
I
like
like to facilitate the work of the board. Yeah, thank you, Helen.
we also recognize, you got it, okay.
We also recognize,
That it's important to have additional conversations to facilitate the work of the board.
Should we say something? Should we say something like to accomplish? Like what? Was it SB 89?
To accomplish our deliverables and accomplish our deliverables.
Yeah.
Facilitate the work of the board and accomplish our deliverables.
Given to us by.
And come.
Could we limit, so instead of saying have additional conversations, could we say it is important to have some limited communication? Among board members or something like that.
can I include committee?
No, because you said the board and its committees, yeah, okay, wait. Are you gonna say among members, because it would include board and committee members? Accomplish its deliverables and. Okay. So.
This is good. Group process is good.
I'm just still wondering if after deliverables, do you want to say where, like, they were dictated by
the legislature.
by the legislature, because otherwise it might sound like we're making up our own deliverables.
Yes, that's true, that's true. Laid out
Should I
in,
say Senate Bill 1089?
yeah.
Could we, I think the final piece I'm curious about is just maybe, is it worth including in our policy that if a board member has a specific scenario they are unsure about, that our policy is that they would reach out to the Ethics Commission for a written decision before initiating that communication?
Yeah.
Just as an explicit option. So if I'm clear that I'm within these bounds, I can proceed knowing the liability. But if I have something that feels unclear with this new law, that I have the option to reach out for a formal decision.
Yeah, so I would say, all board and committee members are encouraged, to, take the training offered by the Government Ethics Commission. Again, it's not required for our board because of our budget level, but all of us are encouraged to go to that training and to, submit, inquiries to the Government Ethics Commission if they are ever unsure of whether or not the communications would be in compliance or not.
Do we want everyone doing that directly, including, do we want everybody reaching out to the ethics committee directly, including committee members, or do we want to like do some kind of like checking with staff, or I don't know.
Well, we're all officially public officials.
Okay.
If we're all on board and committee, we're all public officials. So yeah, so if people have questions, I think they ought to reach out. That's right. Anything else? Any other discussion on this? We seem to have rallied around this option as opposed to the other two we talked about. Does anyone have any other thoughts or comments about the other two, or fine tuning more this option for our policy? Okay, does anyone want to propose a motion to change our policies?
I propose a motion to amend our policies to beautifully drafted. Thank you, Katie and Bruce.
Is there a second?
I second.
Any discussion?
All right, so Helen Belanca,
Yes.
Debbie Diaz,
Yes.
Amy Fellows,
Yes.
Michelle Glass,
Yes.
Chris Goldberg,
Yes.
and Judy Richardson.
Yes.
Well done. Great, we are a little bit behind. Let's look at the legislative status report first. And spend a few minutes on that, and then, can we delay the meeting schedule until December? Okay, we're gonna do that, and then we'll do some committee updates. So we have a couple of, the most important decision for today is finalizing our legislative status report, which is due in December to the legislature. You've all received copies of that, and hopefully have had a chance to review our status report. I want to extend thank you to Morgan and the rest of the staff for the work that they did on it. We have received some comments, and we just want to offer it up now. Do you want to describe a little bit more about what's about where we are with this draft?
Yeah, sure. Really quick background. In August, you established a process for developing this status report. This is the status report that is due to the legislature by December 1st and is a requirement in Senate Bill 1089. In September at the board meeting, you reviewed an outline of what we wanted to include. In October, you reviewed a first draft. That included everything except the letter from Judy and Helen that introduces the update and the status report and the challenges and opportunities moving forward at the end. In between October and November, I sent that, Katie actually sent that out, but we sent out the draft with the letter and the final paragraphs to receive additional comments. At that time, we didn't receive any additional comments. There are some changes in the draft that is before you today. Some errors that we found, just like updating the total number of members on the committee. The initial draft only had the public members. We forgot to add in the board members who are also sitting on those committees. So there are some changes that have been made from the draft that you last saw. And there's a couple of just other edits and word changes. So the changes that are in this draft from the last one that was emailed to you and the version that you reviewed at the October, November are pretty minimal. And today we received some comments and some edits to the final paragraph, the moving forward challenges and opportunities from Helen, and Katie is going to pull that up. So for folks in the room, I think you have a hard copy of that version, and for folks virtual, Katie is pulling that up right now. But I would, this is our last board meeting before that report is due, so I'm hoping that any changes you want to make today can be either specific edits or in concept. And then after the board approves the draft that you're comfortable with, this will still go through a copy edit process with the DCBS communication. So I just want to say that those changes will not be substantive, but will just be a final edit. So we'll get any commas and spelling and grammatical errors in that copy edit.
Great, thank you, Morgan. So the piece that we just really want to be sure that we capture today, if we can just hone in on the challenges ahead, which is the second to last paragraph in the report. I want to make sure that I'm capturing it. I made some edits to this very recently to reflect what's been going on in the past couple of weeks as our committees have launched, and we're trying to get an RFP out for contracting work, as well as what we just discussed around our limitations regarding public meetings law. So for challenges, I added some language that, you know, things of agency processes regarding procurement and limitations on board communication due to public meetings law have slowed our progress somewhat. We're working to mitigate these challenges and still feel optimistic that our work will be completed on time. So just added a little sentence there in challenges to reflect that. And then in terms of opportunities, I added some language about how excited we are to have welcomed members of the public to our committees. They've already contributed a great deal and promised to contribute more. We have some excellent resources with our current consulting team, and we look forward to contracting with a revenue expert shortly and building a financial plan. And then our most important opportunity is with the engagement that we will be embarking on with various groups of interest, including the business community, the healthcare community, and the general public. So it's just some language around that I've added in terms of opportunities. Are we missing any challenges that haven't been captured here in terms of what's been a challenge in moving our work forward that we want to make sure the legislature is aware of? We talked about time, we talked about, you know, agency processes and the communications limitations. Is there anything else that we want to highlight? Michelle?
I'm curious about whether it's worth mentioning briefly the the uncertainty of the federal policy landscape in relation to requesting waivers, or if that is not worth flagging at this stage.
Yes. Yeah, we can add a sentence in there. The changing political landscape on a national level may also impact our
Are you telling me this right now?
Yeah.
Just add, okay, it is
Yeah.
the last sentence under challenges. I have to
other
add.
challenges, yeah.
Okay, please start over.
The changes in the national political landscape may also affect our work. We could leave it at that.
Could I friendly proposed amendment, instead of political landscape, I would say national policy landscape, just to
Okay.
maybe be more specific.
Yes.
Yeah.
Great. Anything else for either challenges or opportunities? Okay, great. Would anyone like to propose a motion to finalize this version of our legislative report with those changes that were just on the screen and authorize Morgan to proceed with submitting it to the legislative staff? Or your motion?
I'm just wondering if, next to the revenue expert, if we also should add communications. Because I think we've already identified that
Yes.
need.
Yeah, so I had in there, we have a current consulting team. I didn't specify
Oh,
who the
okay, all right.
consultants were, yes, but we're.
But we don't have a communications. consultant.
Yeah, maybe I'm.
No, she's community engagement.
Oh,
She's
I
not
see what you're
messaging.
saying. I see what you're
We
saying.
need someone to help us with messaging.
Oh, I see. Got it.
Communications.
Yes, got it. Yes, thank you for pointing that out.
Next to the revenue expert, revenue and communications expertise or experts. I don't know.
Yes, right there, where your cursor is, revenue and communications experts.
Thank you.
Yes, thank you for pointing that out. Yeah, I missed that.
No, let's take that.
Sorry. Yes, no problem. Okay, so we're looking for a motion for approving this legislative report as final.
I'll make a motion to approve the draft legislative status report.
Is there a second? Or you want to read the whole?
Just say what changes. suggest.
Oh, with the changes that we just real timed.
Is there a second?
I'll say.
Any discussion? Okay, let's do a roll call.
Helen Belanca,
Yes.
Debbie Diaz,
Yes.
Amy Fellows,
Yes.
Michelle Glass,
Yes.
Goldberg,
Yes,
and Judy Richardson.
Yes.
Can I share one more thing before?
Yes.
We have, reached out to the House Healthcare Committee, and Judy and Helen are scheduled to present on the status report during the interim legislative days, and that would be a presentation before House Healthcare, December 11th. In the morning, so I'll send information out to the board and make that available to others who might be interested. And we're working with the Senate committee to find a time. Their agenda is full for the December interim legislative days, so we're looking forward to the beginning of session.
Okay, so we were gonna move on to committee reports, and I would like, so we've had 3 of our 4 committees that have met so far. And we can hear from each of those a brief summary of how that's been going, and any report out that you would like to offer the board. As our work progresses, starting in December, I think these committee report outs are going to occupy a large part of this meeting and give us some opportunity to engage across committees and talk about how our work coordinates with each other. We don't have the time necessarily for that today, but we want to do a quick overview about how that might happen. And then we're going to really guard a whole lot of time on our next agenda to dig a little deeper. I think most of the committees have been doing some background and orientation work with their members. We've had 1 or 2 meetings each. And so mostly this is just sort of a trial run of a quick report out on committee work. So should we start with communications and community engagement? Michelle's going to lead that and fill in.
Sure. Thank you. And my co-chair, Amy Fellows, will fill in anything that I miss. My name is Michelle Glass. I'm one of the co-chairs of the Communications and Community Engagement Work Group. We have 14 members and have held 2 meetings. So in addition to the foundational background work that all the committees are doing, the highlights are that this committee has requested and received a presentation from the Oregon, I just lost it. Oregon Advocacy Commission on some community engagement work that they have completed. That was in our work plan as one of our top priorities, to do a scan of community engagement already conducted that would solicit some themes in terms of needs, desires, preferences in healthcare that Oregonians have already been sharing that would help to shape our communications and engagement work. So that was really helpful. We also have been able to introduce the consultant Diana Bianco to the committee, whose contract work will start soon in public engagement to accomplish our deliverables for under Senate Bill 1089. So that was really exciting milestone. And then the committee has been, so far, our 14 members have been extremely active in brainstorming and sharing ideas for places to do outreach, existing reports or other methods of feedback that have already been shared as part of our landscape scan to give us a foundation for our work. And they have prioritized a couple of items to be developed first as a part of our communications plan. So they've identified a frequently asked questions document, a 1-pager in plain language and in multiple languages, sharing about the work of the board, a 1-page plain language multilingual summary of our values and principles that we can share more widely, and a guide for providing public comment to help solicit more feedback to the board and to the committees. So that work is off to a great start. Some of the things that they are prioritizing is strong feedback loops with other committees. So they really want to hear from other committees as early as is practical, what you are working on that you think needs to be communicated out to the public, and or what you're wanting feedback from the public about. So they would like to understand the timelines. So if there's anything that you see coming up that might be a need for communications or engagement support, they would love a heads up so that we can make sure that it's available in plain language and in multiple languages. And they've also made a request for the board to consider sharing the monthly talking points that board members receive with committee members, so that committee members who might also be doing some community engagement and sharing updates about the work of the board within our policies and procedures have the benefit of those talking points to utilize as well. And I think that's what I have, unless Amy has anything to add.
We do plan design next.
Sure, Debbie Diaz, I'm chair of the Plan Design Expenditures Committee. We have 22 members, so a large committee, and we had our first meeting 2 weeks ago. And 21 of 22 members were present. Overall, this was kind of a expectation setting review orientation to the committee, more than getting into the work itself. So we went over the committee administration, a review of the work plan, how the process and timeline and straw proposals kind of fit into the work of the board. We did spend some time as well reviewing our values and principles to just kind of orient and align where we're looking ahead. And then we had Cheryl go ahead and give us a review of the task force recommendations and was available to answer questions that came up. And despite not having a whole lot of dedicated discussion time, there was actually a decent amount of robust discussion and questions, and everybody seemed really engaged and had some excellent points. Some things that came up that I think are worth mentioning. They were wondering about how the PEB benefits were decided. And I think we also had that similar question at one point. So that's actually going to be the theme of our next meeting, kind of going into PEB benefits or how they differ from the UHPGB benefits. There was also a question of whether the plan will include incarcerated individuals, which was a good thing to pick up. I don't know that we discussed that. In addition to that, there was kind of some topics about the line between what we're doing and public health or social determinants of health, and kind of what's our purview, what's outside of our purview as far as realistically being able to afford and oversee. One of the individuals is a pharmacist and brought up a good point that I think speaks to our kind of larger acknowledgement of using the folks that we have and letting them, work to the top of their license as we can to provide care and thinking creatively. So he was saying engaging pharmacists and potentially, managing certain conditions in patients that falls under their licensure. So that was a good point out. And then, I think we've also touched on this, but kind of long-term care and long-term support services and kind of figuring out how that is defined and how we're going to address that. Specifically, there was also some questions about kind of the distinctions between Medicaid and Medicare benefits and how we're trying to align and see what we are including. And then specifically a recommendation for the Finance Committee to consider was regarding auto insurance and liability coverage and how that would fit into our financial plan. So our next meeting will be December 5th, and the topic will be kind of looking at those benefits options and kind of better understanding one versus the other.
Thank you. And finally, finance, our chair, Cheryl Ramirez, couldn't be here today, but Morgan will give a report in her place.
Sure. The Finance and Revenue Committee has 8 members. It's actually the smallest committee that we have out of the 4. They've held 2 meetings so far. The first meeting was just jam-packed with information because of the Legislative Revenue Office's availability. The economic forecast came out this week and they weren't available for the second meeting, so we put them at the beginning of the meeting. So we just jumped right into the information, and the Revenue Committee got a presentation on the work that the task force had done and how far the task force had gone on the income and payroll tax. Warren George also presented information on the Optimist report and looked into the actuarial analysis and some thoughts about work that needs to be done by this group. So the first meeting a reflection that I had was that we didn't spend quite enough time in level setting and building the information about the values and principles and the process. And so in the second meeting, there was kind of a regrounding of some of that high level overview of the committee to board decision-making process and values and principles. And the second meeting, they also jumped right into a presentation to start thinking about building that total health expenditure, the cost target budget with a revenue plan and the steps needed, and looked at some specific data to start that conversation. There were lots of requests for data during that meeting. I think the committee will want to land and figure out like what data sources it wants. There are so many that are out there, and that is, I think, a future conversation of the committee. And there were, in the first meeting, there were quite a few questions for plan design. I think because they were looking at the Optimus report. So a lot of the questions they had were, we should update the actuarial analysis. And so that's why we spent some time in that second meeting going over the work plan overall, so they could see kind of what work was in finance and revenue and what work was in plan design, and where the deliverables were that the board was thinking for the committees. So, yeah. I think that it's the next topic of conversation, but the coordination between plan design and finance and revenue will be key. There are issues of including public health that came up at plan design that also came up at finance and revenue, and depending on how the board wants to take it, there may be issues like that where we want to elevate it to the board, where it crosses kind of committees, and think about how to tackle some of those issues that are kind of crossing both committees.
Excellent, thank you. And our operations committee is set to meet for the first time December 12th. So we look forward to hearing from you. Thank you. And I just wanted to point out that Katie has been working on building a calendar that shows the cadence of all of our committee meetings, so that there's one location where we can see when each committee is meeting and how that relates to the board meetings, when materials are due and that kind of thing. So that'll be a very useful reference on our website to see the pattern of when the committees are meeting, so that that's transparent. I'm going to turn it over to Judy now.
Thank you. I'll try to be concise. Go to the next slide. We discussed, this is the board decision-making process that we hope that the committees will look at and follow. This is the process by which committee work rolls up into an example, a pilot, a straw structure, however you want to call that, a sketch of the idea, the proposal. You'll see there where it starts, the committee takes up the structural component. Staff will provide research and options, and then the committee presents a straw proposal to the board. And the intention is to get a sense from the board whether or not the committee is moving in the direction that the board needs it to go. Then that can go, the board can approve the straw proposal or request feedback, additional bones around that straw proposal, the input of financial and economic analysis. And then after that pink arrow you see, the committee can refine the proposal and it will come back to the board, ideally right along that trajectory that fulfills what the board needs to include in the deliverables. The alternative is the board could reject the proposal, provide some guidance to the committee, requesting them to go back to the drawing board and come up with a new proposal. Finally, at the end, the board can approve the proposal, log the decision in the tracker for final recommendation, and that can be included in the final plan to the legislature. So, committee chairs, thank you for your service and your work. Please review this with your committee members. Next slide. So this is a tool, hopefully, that will be really helpful for exactly what Debbie was asking about, requests for information and questions from one committee to another. This is a shared document for talking points that you come up with within your committee in your public meeting, consolidating like we soon will, what happened during the board meeting. Details clearly are found in the minutes, but if you just wanted the talking points, they can be found here of the board and any committee level. The request then is for the board chairs, when you're thinking about your agenda and your next committee coming up, take a look at this document. there will be highlighted if there are questions from another committee of your committee. Please include those if you can in your agenda of your committee work so that in the public meeting, you can talk about them, come up with an answer, or decide if you need more information that can be highlighted in your talking points as a question for the board or request to the board requesting support and resources like data resources. So these meeting summaries can be used to share the information between committees on this shared document. Put information there that comes from your committee work in your public meeting only, and review that in your public meeting. There's some questions. With this structure, do you think we need board member ambassadors between committees? I sat in on community engagement. It was great. I learned something. I appreciated the way that meeting was conducted. But we can't all attend everybody's committee as well as our own board meetings. And so does it make sense to send ambassadors, or will this tool be sufficient? Can committees ask other committees to policy questions? And does the board need to review those policy questions?
Yeah, so this is all in our attempt to make sure that our work aligns with each other and that we're aware of what other committees are doing. We want to have a tool when we report out so that, you know, we all get a sense of what each committee is working on, and we rely on all of us to have ears toward, oh, they're talking about that might be relevant to the work that we're doing in my committee. Of course, we all need to talk with the community engagement committee about messages we want to get out. And so we're trying to sort of pilot some structures for how committees talk to each other. That will happen a little bit here at the board meeting. But as things come up, we need to sort of do our best to communicate with each other and respond to each other's requests. Does anyone have any thoughts about that inter-committee communication process? Or how the committees communicate with the board?
Amy, I'm wondering if in December, after we like use this tool, we might have a little bit more insight.
Right. Yeah. Absolutely. Yeah, so we'll spend more time on this in December. We're gonna really dive deeper into how committees communicate, but be thinking about that and be thinking about how we want that interaction to take place. The other thing to think about too is what Judy went over with when committees bring proposals to the board. We really want it to be a two-step process. We want a committee to bring a straw proposal if they're thinking about going in a direction. You know, they're thinking about incorporating X, Y, or Z into how they consider healthcare expenditures when they're coming up with the total cost of care. And that's not explicitly laid out maybe in our directive to them, but they're thinking about doing that. We want them to bring that to us early. And then we can say, yep, we agree with that, go ahead. And then they do all the work for it. What we're trying to avoid is for committees spending months on an idea or on a recommendation and then bringing it to the board. And the board's like, no, that's directionally not where we want you to go. So we want recommendations from committees to be in a two-step process. If it looks like you're consolidating around an idea, bring it to the board as a straw proposal, and the board can say, yes, we like it, work on that, and then bring it back in two steps. So as recommendations start to bubble up, we'll test that out and make sure that that's working. But those are the two things to consider as you do your committee work: how we talk to each other and how recommendations are brought to the board. Any other thoughts on that topic? Any board outreach requests that anyone has gotten that you want to bring up at this point? Has anyone gotten any requests to speak or community engagement that they want to talk about? Yeah.
So Lee County Commissioners, which is also their Board of Health, at their meeting on November 5th, today, they had a agenda item that Eve Gray, who's the Director of Health and Human Services, that's on, I can't remember which year, Plan Design Committee, got on the agenda to create a resolution for the county commissioner / Board of Health to support the work of our board. And it was passed unanimously, and myself and two of our, our community engagement and communication members gave, public testimony in support of it. So one thing that I want to know, and I also remembered / learned that Multnomah County had already had a resolution that actually went even further than just supporting, because we didn't exist when they created it, but supporting the concept of a universal health plan. But I would like to know and see if staff can kind of track other county or city resolutions. It was a strategy that I know worked for House Bill, I think it was 42.
Yeah, that's a great idea. Great, thank you. Anyone else do a presentation or receive outreach? I'll offer that I received outreach, I believe a number of other board members have as well, from Healthcare for All Oregon to come and meet with them and talk. So we are setting that up and pursuing it. If anyone else has a thing else that they've been invited to. Great. And I think our primary meeting takeaways are around the ERISA presentation, around the change in our board policy and committee communication. So I can work on that with staff. We have one person who has signed up for public comment. So we can go to that. I believe it's Lou Sinninger, who's going to be testifying virtually. Lou, are you available? Lou, can you hear us?
On their device.
Yeah, I'm trying to get on that to different devices.
I'm sorry, is he the only one?
Yes. So Lou, we'll give you another 30 seconds or so to try and come off mute. I don't know, you looks like you're still on mute. We can't hear anything you're saying, so we can see that you've joined, but maybe take yourself off mute if you're able and chime in whenever you're ready. We'll give you a little bit more time and then we'll move on.
If he's on the phone, it's *6 to unmute.
Okay. Sorry, I had you on my phone also, because, all right, I'm
Okay,
here.
so you have 2 minutes, Lou, to offer your comment.
All right, so can you see me yet?
No.
Oh, thank you. There I am. Good God. So I want to thank the board, first of all, for doing what you're doing and giving us hope for the future. As you know, my name's Lou Sinninger. And by the way, Amy, I'm the person who brought the resolution to Eve Gray. Anyway, I'm a retired union rep out of AFSCME. And for the last 10 years, I've been volunteering my retirement time to Healthcare for All. And I just want to commend the Oregon Health Authority for the Oregon Health Plan. As you know, out of the 4.3 million people in Oregon, 1/3 of them are on the Oregon Health Plan. So that's really great that people are getting health care, but there's some downsides that I want to bring up to the board. Those downsides are, as I've been tabling throughout Lane County and other places, I've come across a lot of people on the Oregon Health Plan. And the stories I get is that people are keeping their work time as halftime so that they still are able to qualify for the plan. I've met people that haven't got married because if they got married, their partner would disqualify them from the health plan. I've met people that have quit their job because their job didn't give them the health care that they needed so that they could get on the Oregon Health Plan. So these are things that are not giving us the production out of our population that we need. And the other thing I'd like to bring up to the board is how much does it cost to administer the Oregon Health Plan? All that money would be saved if we had universal health care. So please, go forward as quickly and as surely as we can so that we can get full capacity production from our citizens. Thank you.
Lou. Thank you, Lou. We appreciate you providing comment. We have a closing quote. Did anyone, who submitted this?
It's Bruce's.
Oh, Bruce, go ahead, Bruce.
Well, the quote is from James Baldwin. It says, "Not everything that is faced can be changed, but nothing can be changed until it's faced."
Excellent. Thank you so much for that. And thank you all for your participation. And with that, we are adjourned. We'll see you in December.
Oh my goodness.